back to my channel. My name's Simran Hilary and I'm a 5th year medic studying at Imperial College London. So exam season is literally upon us, and it's in a way that I have never experienced before, and many of you that are watching would have literally never experienced before either. It's the season of online open book exams. What? When we first got told that our exams would be open book, I was completely mind blown. I was like, having access to my notes during an exam is so beyond me. And I've literally spent the last few weeks trying to figure out how we as a unit can basically study smart for these exams. So I'll basically be giving you the lowdown and sharing my insights with you throughout this video, which will be split into 3 segments. Firstly, we'll be going through content-specific preparation. Secondly, we'll be looking at the online exam toolbox. And thirdly, we'll be looking into having the right mindset. Timestamps to all of these will be down below, so you can rewatch, skip, forward, go wherever you want in the video to get the maximum benefit. First is content-specific preparation. And what I mean by that is guiding our revision in a way that we are preparing for the content that is most likely going to come up in an exam. And I'm going to be starting off with the real basics here because it's so important to have a solid foundation in order to build a very sturdy and amazing building. So first thing we need to know is exactly what our course comprises of. Lectures, tutorials, extra reading, everything. Whack it on a spreadsheet, whack it on a piece of paper so you are able to visualize everything that could potentially come up. Next, we want to look at the exam rubric, and this is how we're going to be tested, how long the exam is, what types of questions are coming up, so we know exactly what to prepare for as well. This together kind of forms the specification for your exam. Now that we know what our course looks like, it's so much easier for us to go in and see what the high yield content is. Now, what do I mean by high yield? High yield is basically learning the material that will give you the maximum amount of benefit in the exam. So for example, with respiratory medicine, I know things like asthma, COPD, pneumonia, pneumothorax. These are the core topics that are going to come up. This is the bread and butter of respiratory medicine. These are the conditions that I'm going to see again and again in patients. And this is why I need to focus on this content, because I know that it's more likely to come up in the exam because it is common. Common things are common. Now, you may be like, okay, I can figure that out in a clinical setting, but Sim, I have exams which are lecture-based. What do I do for that? And guys, I got you there too. For lecture-based exams, it's so important to know who your course leads are. And these are the people who are going to be writing your exam. They're going to be marking your exams. So it's so important to know their lectures inside out. So you want to make sure that you're covering their lectures in the most amount of detail, whether it mean rewatching the lecture, doing the extra reading that they've sent you, and you want to make sure that you are prepared for what they're about to throw at you. And the likelihood is that you're going to be tested on these topics and these lectures in more detail compared to the rest. That doesn't mean you don't revise the rest of the lectures. Guys, my favorite topic, practice questions. And I literally cannot stress this enough. Find all the questions, that are out there related to your course. So looking at past paper banks. For medicine, I use Past Med. They should really be sponsoring me by now. But anyway, looking at questions that your university has provided you. Then asking older years, what has come up in exams previously. Not only will all of this help you gain more knowledge about the topic by doing questions. If you get anything wrong, you can review, you can, figure out where your weak spots are. Doing these questions literally helps you see a trend emerge. And that trend is the high yield content, guys. This is the stuff that's going to be tested again and again in questions. So it will help you figure out where you need to focus your attention. And whilst I've been revising for my exams, the number of times when I've been doing pediatric questions, croup, bronchiolitis, asthma, meningitis, all of these things have come up. Guys, this is the high yield stuff. And questions are so good at helping us figure this out as well. So next we have the online exam toolbox. And this toolbox doesn't mean we don't revise for our exams and solely rely on our notes to be getting us through these exams. No, we've accumulated that knowledge in our brain throughout the year because we've gone to uni and our exams are so time pressured. So referring to our notes every 2 seconds to actually answer the question is literally just not feasible. However, we still do have access to all these resources. So the toolbox is all about optimizing for how and when we are using the resources available to us in order to gain the maximum amount of benefit. So first thing in this toolbox is the high yield topic summary sheets. And these sheets consist of tables, diagrams, mind maps that really kind of summarize these high yield topics into one sheet. And this is something that, you know, we can glance over at or look at during the exam. So on the day of the exam, I'd probably have these laid out on my table. And this is not cheating at all, because the examiners know that we have access to all of this and they encourage us to use these resources which are available. I know in my exam, it's very likely that I'm going to be asked about how to manage a febrile child, so a child who has a fever. And there's different criteria, which means that they're low risk, medium risk, and high risk. And there's a really nice table by NICE, with NICE guidelines, which kind of summarizes all the different criteria. So I know for sure this is one of the things that I'm going to have on my table during the exam. Another example is childhood immunizations. This is something that I need to know for my exam. I need to know at what month and what immunizations are given. And the list is literally so long. And I know one of my weaknesses is that I just find it so difficult to memorize stuff, like which are like long lists like this, which don't really require that much understanding, but it's literally just rote learning. And that's just so not me. And I know it would take me ages to actually memorize this. This is going to be the first thing that goes on my table. Now I don't have to waste time memorizing something that would have taken me so long, because I know for a fact that it's going to be one of my summary sheets. Now, as we get closer to the exam, what we're going to have on our table will change, because the amount of knowledge we're accumulating going closer to the exam will change, and we will become more aware of where our strengths and weaknesses lie. So I think, you know, preparing maybe a week or so before the exam, knowing like, you know, these are what my summary sheets are going to be. And again, it's a great way of reviewing the things that you may not be that confident in. That's why you need that summary sheet. The next thing in our online exam toolbox will be familiar notes. These are notes that we've literally been studying from throughout the year. We are so familiar with them. We know exactly what's in them and what they don't consist of, ideally opened up on our laptop. So let's say in the exam, I get an ECG trace, which shows absent P waves, a prolonged QRS complex, and tented T waves, okay? How would you manage this patient? So I need to figure out what the condition is, and because I've been doing the studying, I know that this is hyperkalemia. And I know the management roughly is giving things like calcium gluconate, dextrose, and insulin. However, in the exam, I've forgotten the percentages and the volumes. This is where the familiar notes come in handy. I know that in my path guide, in the chemical pathology section, they've talked about the treatment of hyperkalemia. And so all I have to do is control find hyperkalemia, and it should bring me to the page where, you know, I can figure out what the volumes and the percentages are. And the reason why I know exactly where it is, like I can literally visualize it on the page, is because I've been using that resource to study. Now, this whole process requires a few things from us. Firstly, it requires us to have an understanding of the topic that we're being asked the question on. Secondly, it requires us to know exactly where to look and what to look for. And this only comes through studying. The online toolbox is there to help us when we're stuck and make it easier for us to actually look things up. Third thing in our online toolbox is something that we use literally on the regs, which is Google. This isn't going to work for every single question that we get asked, because the majority of the questions that we're going to get asked are going to be questions which are based on application of our knowledge. They're not going to be plain fact recall questions. However, Google is very good at plain fact recall. So, for example, if I was to get a question about what stain is used to see TB on microscopy, now that is a clear-cut question that I can literally Google TB microscopy stain, and then we have the answer. So Google is only good for plain fact-based questions. It's not good for any questions where we're going to be applying our knowledge. Everything that we've discussed so far is literally not a replacement for working hard and studying in our exams. Like I said at the beginning, it's just about optimizing the marks we're getting in the exam. But in the exam, it's all about answering the questions that we know. Like, yes, we got this, we got this, we got this. But then leaving the questions that we don't know completely, or that we're stuck in two options. Like, those are the ones where, you know, the online toolbox will come in handy. So the next thing is having the right mindset. This is an incredibly difficult time that we're going through, and it can be so difficult to study at home given your situation at home. And there's so many factors that play into it, and it's so important to let your university know if there are certain situations that are going on in your life that means that, you know, you may not be able to perform to the best of your ability, and the university needs to know that. And as much as I would have literally preferred not having exams, they are happening, and that's something I can't control. But what we can do, guys, is how we approach these exams. And I literally always try and have this positive mindset where I'm like, you know, we got this, we're gonna do well in these exams, we're gonna smash it. And it's so important to have that, because especially during this time when like I lack so much motivation. I just want to say, guys, I got this, you got this, we got this together, and we're going to literally smash our exams. I literally believe in us so, so much. So yeah, that's basically all I have to say about how to study smart for these exams. I really hope that, you know, there's something that you can take away from this video and it's going to help you during this revision season. Please share this video with anyone else that you think is going to find it useful. Please make sure you drop a comment down below. I want to know some of your study tips during this time. Give it a like and please subscribe to my channel, and good luck, guys. See you next time. Bye!